I would like to welcome to simulation faculty. We are a very small but very enthusiastic faculty at Medway Maritime Hospital. We offer a varied range of multidisciplinary simulation-based education here. I strongly believe that if you work as a team in clinical area, you should train as a team as well. And it's not just the clinical knowledge which is important. There are so many other things which come in play when you are treating critically unwell patients, or you are communicating with patient, you're talking to your colleague, or you're ordering a test. And we concentrate on those factors called human factors. Situation awareness is very important, knowing exactly what's happening, what could go wrong or what will happen, what you need to do. All these things are very important, and these are all part of human factors.
We've got an excellent simulation suite here, and we've got very good staff who all collaborate together. We have programs drawn up for the entire year, and these are open to all staff in the trust, to trainees, junior doctors, even consultants. We have programs which deal with acute emergencies, pediatric, medical, obviously all the other specialties, and we also are trying to set up scenarios for non-medical situations, dealing with difficult interactions with carers, with patients, maybe members of staff, dealing with situations where there are safeguarding concerns, so things which they will face in their careers at some point.
We do have day release courses for human factors training. We have day release course for debriefing training. We have a course called WOW, Working Without Worry, for transition to foundation trainees. We provide sport, which is a supported return to training for trainees who are away from training for health issues or carer, or any other problems. We provide regional courses, and we have specialist courses like multidisciplinary team training for emergency department, theatre teams for critically unwell children, and obstetric teams.
This is our simulated GP reception or homeroom. Within about 5 minutes, I could change the scenario and set the scene for a homeroom. And as you can tell here, I'm going to show you that we can change to a kitchen scene. We can also change to a living room scene or a GP, and it's fantastic facilities to allow for communication scenarios, emergency out of the hospital scenarios. Welcome to our simulated ward. This is the main area that we work within, especially with the trainee doctors. We have 3 bays that can have multiple patients having different problems at the same time. We utilise the mannequins from child, baby to full-blown adult and pregnant mum. You can carry out procedures on the mannequins or the kit that we provide, and you can call for help through our simulated phone. We also use live actors within the scenarios to allow for communication elements to be learnt. This is our simulation theatre. We adapt this to feature areas such as intensive care, resus, operating theatre, or anything else that involves a non-ward training session. This is a fantastic area. We also do clinical skills teaching. It allows for trainees to come and use our skills mannequins and practice things like central line insertion, arterial line, even cannulation, catheterisation. So it's a really, really great area to come along and utilise our skills. Welcome to our debrief room. This is where the main point of learning happens. This is where we give you a safe and secure environment to talk about the scenario that you've just taken part in. We can also address back to that scenario and watch a recording. This is a perfect environment for your group to discuss anything that you're not entirely sure about, and you can learn from.
I'm Gary, I'm the simulation technician here at Medway Hospital, and I set the mannequins up. I do moulage, so make fake wounds and things like that. I'll set the parameters on the heart rate, blood pressure and things to make the scenarios more realistic.
We focused on lots of scenarios in simulation, but the one that we're going to focus on today started off in theatres, and it's a typical day, very busy, short-staffed, big lists. We're all quite bad at saying the appendix, not referring to the person by their name because of confidentiality. So we tend to fall down in certain areas. That day at 8 o'clock during changeover, you don't allow for the break for handover. So a patient was sent for an appendicectomy. And so the surgeon went to the theatre receptionist to ask to send for the appendix. The receptionist sent the porter to the ward to go and get the appendix. The porter followed correct protocol, went to get the patient that was given to him on the call slip, and collected the patient and took them to the anaesthetic room. The patient went in to have their appendicectomy, and the procedure had started, all smoothly running, until the member of theatre staff came up to the senior and said, "It's the incorrect patient that's on the computer." So there's a number of points where you can see that incidences happen, and in simulation we try to mimic this within the scenarios to allow for it to be as realistic as possible.
We do a lot of EDs, in situ simulations, which basically means that we organise simulations in the new resus. So we design everything in there, and it's quite frequent, and it's useful for the juniors because they get to learn to manage acutely unwell patients. So although it's mandatory for quite a few of our doctors, we do get a lot of junior doctors that volunteer to help and to join in on the simulations, and they would like to get more experience.
We have a very popular program already running, which is run in collaboration with the PICU team at Evelina Children's Hospital. They collaborate with us and have helped us to improve our management of sick children presenting to the hospital, either on the wards or in ED. It has helped us to improve our teamwork and dealing with various human factors which are involved when we are dealing with sick children.
In intensive care, things happen very fast, and therefore you need to have a spinal level reflex about some scenarios, at least, that you need to fix them very quickly, and just one person knowing everything doesn't work. Everyone needs to know it at the right level, and we are practicing the set number of scenarios that go wrong routinely in intensive care scenario. Plus we are also practicing something which have gone wrong outside that box of scenarios, and we have measured what is their confidence level after and before, and is it changing after practicing the scenario in simulation.
For our MTIs, who represent a significant number of people on our registrar pool, one of the things we noticed when we first started using them was that they weren't necessarily familiar with the NHS system. So while some of them are very skilled in the countries that they come from, they weren't necessarily understanding how we work in the general wards and also in the acute situation. One of the things we're really proud of is bringing them through simulation, learning to address some of those cultural issues. And of course we've learned a lot from them about how they need our support in managing that. They've had the opportunity to develop rapport with each other in a safe environment, but also rapport with the nurses and other colleagues that they'll be leading in situations, and our feedback has been excellent. In fact, one of them in particular wants to bring simulation back to his home country and is looking at business cases for doing that, so I think you can get any better measure of how useful they found the experience.
Coming to the UK, I had to learn during this course how to be able to communicate your findings to your consultants, being able to have a good network discussing with your team members, and also the very, very important factor whereby every member of the team is important, be the nurse, the physiotherapist, the social worker, the dietitian. So definitely I would recommend this course for every IMG who comes in newly into the trust.
As a simulation faculty, we run Teddy Bears Hospital, which introduces children to hospital. They bring their teddy bears, they go through GP, get appointment to have MRI scan. We have a superb miniature MRI here as a part of Teddy Bears Hospital. Then they go and have their teddy treated in hospital. Their teddy may be part in intensive care unit, being very unwell, and they treat their teddy there as well. And this program has been very popular.
Really looking forward to meeting you all. I will be here the whole time, so you'll see me. I'm one of the faces of simulation. I will be taking part and I will make you feel as comfortable as possible. It's an enjoyable experience.
Our extension number is 6816. Please contact Gemma Wrighton or Gary Knowles or Elizabeth Rickard. We are very small but enthusiastic faculty with lots and lots of opportunities for simulation-based education, as well as being a faculty yourself. Please come and see us if you are interested to be faculty in simulation-based education.